There's so much learning from the HIV.
For many delegates at the International AIDS Conference, HIV wasn't the only virus on their minds. Protesters called for more access to monkeypox vaccines. The shots remain in limited supply in wealthy countries like Canada and the US, while African nations with the bulk of global deaths have no doses at all.
It's a problem that vaccine is not getting to those communities for whom this kind of epidemic can be catastrophic.
This public health researcher says just like with AIDS, infected individuals who are gay, bisexual, or trans could face stigma, even violence. But unlike during the AIDS crisis, there are already tools in place to fight this virus.
We could have responded to monkeypox and we could have shut it down. Some people made the decision not to do that, not to try. And now we will likely be living with monkeypox in our communities for some time.
And while the predominant...
This specialist from McGill University says more research is needed quickly.
We lack a lot of information about how to deploy the vaccine, how effective the vaccine is, what treatments we should be using.
Global cases remain mostly among men who have sex with men. Federal officials say they're trying to raise awareness and stop the spread.
Number one, lesson learned, which has really, I think, served us well moving forward with monkeypox, is community engagement.
Epidemiology, the health authorities have to
Despite those efforts and high vaccine uptake, more than 100 monkeypox patients have already visited this Montreal sexual health clinic.
Start like that, very one smaller cert.
Dr. Réjean Thomas showed us examples of the painful lesions.
We're seeing a lot of patients with very severe disease. One of our patients have to be hospitalized because he could not swallow.
Roughly a third of his monkeypox patients are also battling HIV. It's a pair of public health challenges the world is now fighting in tandem, with no clear end in sight. Lauren Pelly, CBC News, Montreal.